In this time of social distancing, if you're feeling sick, what do? Doctors are being inundated right now at traditional doctor's office. Matter of fact, if you can avoid going there, you probably should. You might get sicker. But Dr. Ken Oda of O Longevity Wellness is here with how he can help. It's good to see you, Dr. Oda. How are you?
Good seeing you, Terry. Doing well. Just been doing the social distancing and feeling pretty healthy.
Well, good. I'm glad to hear that. And thank you for sharing what you're doing in order to help your patients and help others. First of all, explain to everybody at home what O Longevity and Wellness is.
Absolutely. So O Longevity and Wellness is a concierge medicine practice I started about a year and a half ago. Basically, the concept is it's a membership-based clinic. So the individual or the family pays an annual membership fee. And there are a lot of things that are included with this, such as an annual executive physical, quarterly check-ins, blood profiling every year, and access to me at pretty much all hours of the day for any sort of urgent or emergent issues.
Okay. We've heard a lot of people call it concierge medicine. Is that basically what it is?
Yeah, it sounds like a foo-foo term, but really I figure it's a term that people understand,
right?
And it's used pretty commonly. So yeah, I stick with that.
All right. Well, then let's talk about that a little bit, because first of all, it's not any. Explain right now. You're doing a lot of telemedicine only because you have to, but you still can even once you become a member. What is telemedicine exactly, and who's really a good candidate for it?
Sure. Honestly, so I've been doing telemedicine for quite some time now. It just so happens that I'm doing it with higher volume now because of what the situation that the pandemic has thrust us into.
Mm-hmm.
But very simply, telemedicine is a doctor's visit through video conferencing or telephone.
Okay, just like what we're doing now, right?
Exactly, just like this, except our conversation would be totally tailored to whatever your clinical need is at the moment.
Okay, and you can diagnose and you can prescribe still through telemedicine, is that right?
Oh, absolutely. I can triage, I can medically evaluate. I will tell you that, telemedicine is not the end-all be-all in healthcare, but certainly there's a lot you can accomplish. There's a lot of people that you can help through it in an efficient, effective manner. And yes, you can do some diagnostics and treatment through this medium.
So what are the benefits of the type of medicine that you offer and having the opportunity to use telemedicine?
Well, I'll tell you, I think the people that probably benefit the most right now are those that are in quarantine, isolated. And let's say this pandemic wasn't even happening. Those people that are homebound, they either have physical disabilities or they're elderly, frail. It's very taxing to get them out of the house to go to the doctor's appointment. This is where telemedicine comes in really handy. And so,
like you said, you've been doing this for a while, so I'm gonna guess that you're kind of ahead of the curve when it comes to being able to really take care of your patients. Is that right?
Well, I don't know if I'm ahead of the curve, but certainly I always try to stay cutting edge and make sure that I'm offering the best medicine for my patients.
Excellent. Awesome. Well, Dr. Ken Oda, thank you so much for being part of Sonoran Living and explaining what it is that you do and how it can benefit us. And I want to give our viewers at home some more information. You can contact O Longevity and Wellness to ask about their concierge medicine, memberships, and their telemedicine visits. You can also call this number 480-365-8035 or visit the website drkenoda.com.